Welcome to an update on arrhythmias and COVID-19 with the vaccine. Delighted as always to welcome Dr. Matthew Fay, our trustee and medical advisor at the charities, but also we welcome Greg Fell. Greg is Director of Public Health in Sheffield, graduated from Nottingham University with a degree in biochemistry and physiology, and has worked as a social researcher and a number of roles in health promotion and public health before joining the public health training scheme. Also, Greg worked in Bradford, and so Greg and Matt are well known to each other. And most recently, he's worked for Sheffield as Director of Public Health. So thank you both for joining us. So back in December 2020, Matt, we recorded when the first vaccine was released, and that educational piece has received almost 60,000 views on YouTube. A few months later, we recorded again when the second vaccine was available in 2021. That's also received nearly 60,000, and we thought it was time that we updated, especially with the booster and the number of concerns that many of our patients have, whether they should have the vaccine, not have the vaccine, what about the booster, does it cause arrhythmias, etc. So I would just like to discuss this with you, fire some questions that we are regularly receiving, and hopefully you can reassure many of our patients that contact us. Matt, I'll start with you, if I may. And I know, you've been inundated and trying to roll out the vaccine in your part of the world. How's that going now?
So the vaccine has been a great success for our patients. We've had many thousands of people come forward and come to our appointments and walk-in centres and be vaccinated. And almost certainly a degree of the freedoms that we're starting to feel after the heat of the Delta pandemic is due to the fact that people have come forward for vaccination. So we've had a great response. It's been a great deal of work from the primary care teams as well as the public health teams to make sure we've got the vaccine out there for people. I think it's given some uncertainty with the fact that the process seemed to change. So we had our first and second primary vaccines, and then of course realizing that some people who were on certain medications may have not received the protection we would have hoped for. We had to then roll out in certain groups the third primary vaccine, and then of course the booster program that got so ramped up just before Christmas because of the Omicron variant. And I appreciate that for some people that's led to some uncertainty, but having said that, this is a disease that we weren't dealing with at all in 2019. And we're now protecting a large proportion of our population from in 2022. So the science and the medicine has progressed incredibly well and incredibly rapidly. But what has also helped is that people have listened to us, they've listened to the medical advice, the public health advice, and they have come forward for vaccination whilst continuing to wash their hands, cover their face and keep that 2 metre social distancing, which has been a valiant effort from the population. And
Greg, what are your comments?
A few thoughts. One, Matt's just done my job for me, so thank you. It's fair to say that I think the availability and the implementation of the vaccine programme has fundamentally changed the course of the pandemic. There's no bones about that. The science on it developed quickly. It's fair to say that the basic science had been done years and years ago. So when we had the genome sequence, you can make the vaccine and then test it really, really quickly. And all the stops were pulled out to test that really quickly. There is zero doubt that the vaccine is safe and effective, and will pick up side effects as we go, I'm sure. That has saved countless lives, undoubtedly saved countless lives. As Matt said, the science is developing all the time. Both the science and the medical practice to implement the science have kept up with that as it's gone. And the implementation of the vaccine programme by the NHS in all of our localities has just been stunning achievement of logistic organization and the commitment of all of the professionals that have pulled out all the stops to do it. They deserve a great deal of credit. And last point, Matt briefly mentioned it, the acceleration of the booster program just before Christmas just gone. Undoubtedly, that was a humongous effort. But it saved, again, countless lives, because at that time it was clear that Omicron was going to break, and it did, as we've all seen. The science was pretty clear that 2 doses wasn't enough. You needed a 3rd dose that we call the booster dose. The booster program was going pretty quickly, actually, but it was clear that we couldn't keep up with the speed of the Omicron wave. So the huge acceleration of the booster program delivery in the 2 weeks running up to and the week between Christmas and New Year was a stunning effort and saved countless lives. Someone somewhere will have counted the lives number of saved, but I dread to think what that number is. But will have saved many, many lives and many people from serious illness and hospitalization, for something we should all be thankful.
Absolutely. And Greg, you mentioned, because a lot of people are very concerned because the vaccine came to market so quickly, compared to, people are saying, well, why can't they find a vaccine for cancer so quickly, or whatever. So you touched on that just now. So the groundwork was done, you said already.
Yeah. So Sarah Gilbert, Prof. Sarah Gilbert from Oxford, did a beautiful piece on this on the Life Scientific podcast. In short, there were 5 main points that she made. Well, one, the basic science had been done in the decade previous. So in the time between the swine flu pandemic and this one, the basic science on how you would develop a new vaccine very, very, very quickly in the context of a pandemic illness, all of that desk-based science and basic science had been done and was kind of ready to go, waiting for the virus that turned into the pandemic. Well, we had that, we sequenced it fairly early. Second point is that the process for approving a new vaccine or any other medicine, but this is a vaccine, the process for approving a new vaccine, there's a set of processes that are well laid out by the medical regulators. They're normally followed in sequence. So you do step 1, which is the desk-based science, then you do step 2, which is the basic safety clinical trials, and then you do big phase 3 trials. They will all run very, very quickly and quite often in parallel to each other, because of the need for speed to get this thing approved by the medical regulators. And the third main point is that the governments across the world poured resources into this. Usually vaccine science just isn't a very sexy place to be. All of a sudden, developing a vaccine for this particular illness was the most important thing in the whole planet. And accordingly, governments poured money into it. And then the fourth bit of the step is the sort of the process of the regulator approval for us, the Medical Healthcare Regulatory Authority. That was followed by the book to the letter, because everyone was acutely aware that this had been developed quickly for good reason, and no corners had been cut in that process. But the actual process of giving approval, I think everyone was clear that had to be done absolutely by the book, and was done absolutely by the book. So all of those things together meant a very, very, very rapid approval process. But it's important to be clear, it is approved by the MHRA, as with any other medicine that is used in the UK, and no corners were cut in that process, albeit they were very, very accelerated.
So we also heard Professor Van Tam tell us that, of course, the desire was that we would be able to do this in 12 months before the pandemic. We actually did it in 9 months. And because of everything we've learned in this pandemic, almost certainly the next one will be 6 months. So, not only did we have the technology, as Greg's outlined there, but that technology has continued to learn from what we've done and move forward yet again. So hopefully the next time, and the next time is inevitable, but the next time this happens, we will be even better prepared.
It's, I mean, as you know, the whole ethos of the charities is working in collaboration. And this is just an amazing example of how, when governments, countries, regulatory bodies, everyone work together, how quickly something can be turned around. The other question, people often get hung up on which vaccine they will receive, which if we reflect, when we take our children for their vaccine, we don't know the manufacturer, or when we have medication, anesthetic. We don't stop and say, well, which anesthetic am I having, doctor, before my operation? But the whole country, the whole world has almost got hung up on whether they've had this vaccine or that vaccine or whatever. Do you think that this will ultimately could be a positive because patients have or people have engaged more about their health, will want to engage more? We've been working on shared decision making, choice, patient choice. Do you think this will encourage the public to discuss more with their healthcare professionals, so together you can come to more informed decisions on whatever disease that they may be sitting in front of you with?
It could do, all up, notwithstanding the sort of the AstraZeneca blood clot issue, which is a particular issue in younger adults. Notwithstanding that, and we'll come on to that probably. All of the vaccines available are all much of a muchness in terms of the immune response that they induce. In the grand scheme of things, yes, there are differences. Yeah, as you say, my kids have had countless vaccines. I haven't got a clue what brand they've had, and no one asked. I don't know how that will play out in the future, but in theory, you would think that people would become not more discerning, but more inquisitive and questioning about the risks and benefits. Vaccination is medical intervention. We should all go into that with fully informed consent. The more people ask those questions, the more informed that consent is. So that's one of the spin-offs of this, and probably one of the positive spin-offs of this.
Exactly. I'm a very positive person. Yeah. So I always try to look for a positive, thinking this may be a positive from COVID. Yes, Matt, sorry.
I absolutely agree, Greg. And I think that this has two sides. One is that I think it's great that we've got patients and our population has become very interested in this pandemic and about what we're doing about this pandemic. I suppose during lockdown, there wasn't much else to do apart from read up about the pandemic or learn how to make soda bread. I think it's really good that we've got that. And I think it's really important that people do make personal decisions. I think the question that we have to ask is, what is the quality of the information that we're giving our patients? So, Trudie, I know the pains we go through whenever we produce something for Arrhythmia Alliance or AF Association or STARS, that we make sure the information is as good as it can be from the experts around the world who can give a decent opinion. Where unfortunately I do worry that Karen on Facebook became as expert as people like Greg, or even as Chris Whitty and the team within the heart of our government making these decisions. So source of information I think is important, but the fact that people want to be informed and want to make decisions, absolutely fantastic. I think that's a definite positive throw off.
Yeah, I agree. Just to add on the source, and funnily enough, it's Karen from Facebook that I always worry about too. I usually point people towards two sources, two very reliable sources. One is either a nhs.uk or a gov.uk website, and unerringly the information on those is pretty good because it's quality assured. We know there's a system in place to quality assure that information. The other one is, to their credit, the BBC have done a really, really, really good job on vaccine information. There are other places. There are plenty of other places, and I'm figuring some of your websites are also pretty good because you've got people that do the quality assurance. But I usually I'm very wary about pointing people towards places that I don't know have good quality assured information. And yes, I make an informed decision. I can make an informed decision not to be vaccinated, and if I make that decision and I'm fully informed, then that's my choice. I've got to take responsibility for that. But if the basis of the informed bit of informed consent is what Karen on Facebook said, then that's arguably not truly informed consent, because it may not and probably isn't factually accurate information.
Well, I think we all hope that another positive out of COVID is we address all these things on social media that have really scared some people, and some people have lost their lives because of it. So moving on to some of the questions that we receive regularly. We'll start, this is asked over and over again. Are there any risks to having the vaccine? Now, I know that's how long's a piece of string?
Of course there's risks, but let's think Trudie, about a lot of our patients within the AF Association who've asked us the same question when it comes to an oral anticoagulant and the fact that this will stop you having a stroke. Well, it doesn't stop you having a stroke. It really reduces your risk. It unfortunately can make you bleed, but the benefit is very, very much on the side of stopping you having a stroke compared to its complication. So if we think about the vaccine in the same way, there is no medical intervention that comes with no risk to the patient. The question is not, is there any risk? It's, is that risk greater than the benefit? And when we look at the vaccine, you just have to look at the millions and millions of doses worldwide that have been administered. If this was significantly killing people, there would be bodies stacked in the street. So are there risks from the vaccine? There's a risk from any medical intervention. Is that risk as great as the benefit in preventing you getting COVID or that COVID infection, meaning that it becomes a risk to your life or limb? And the answer to that is no. The risk-benefit ratio is very, very much over to the vaccine. But is it 100% safe? Nothing in life is 100% safe. Crossing the road isn't 100% safe.
Spin on same answer. Yes, there are risks. There are significant benefits, as is well trod. The risks range from trivial. I've had 2 doses of AstraZeneca and 1 dose of Pfizer, and I got a sore arm on all occasions. Actually, really quite a sore arm as well. Didn't get a Mr. Bump sticker from the GP. I was very upset about that. But I did get a sore arm. I know plenty of people who had pretty severe flu-like symptoms for a couple of days. You've been wiped out. Mostly they resolve with paracetamol and a bit of time. Sometimes COVID doesn't resolve with paracetamol and a bit of time. So there's a kind of risk and benefit thing. And then the thing that certainly was worrying a lot of people in spring-ish last year was the clot risk from AstraZeneca in younger people. It's there. There's no two ways about the fact it's there. It's a real it's a real thing. But it's vanishingly rare. I couldn't quote numbers off the top of my head, but it's kind of in the struck by lightning type of territory in terms of frequency. Yes, it exists, but there are benefits from having the vaccine. And actually, whilst yes, the risk of having a clot in someone who's had an AstraZeneca vaccine, particularly in younger adults, is there, there's also a risk from having a clot following an infection. And the infection clot risk vastly outweighs the vaccine clot risk. So as Matt said, nothing is risk-free, but in all circumstances, and it's a real struggle to think of a scenario where infection risk outweighs vaccine risk. But then the reverse is true by many orders of magnitude.
A lot of ladies wanting to get pregnant or who are pregnant are very concerned as to whether they should go ahead and have the vaccine. What are your thoughts? What is the science on that?
I would recommend that all of them go to the fantastic resources from the Royal College of Obstetricians, where there is some fantastic data. I think many of us have watched one too many science fiction films about the RNA and DNA getting into our circulation and turning us into various mutant animals. That is not what this vaccine does. This is very safe in pregnant ladies, and pregnant ladies, of course, carry a higher risk from COVID, so it's really important that they get vaccinated. But we also know that ladies who have conceived shortly after having the vaccine don't have risks within their pregnancy. So, I've had this conversation with staff in Affinity who have had caution about wanting to have the vaccine because they're young and seeking to have their family. And I'm glad to say there's some fantastic resources out there, as Greg says, from very reputable organisations that can give a lot of reassurance in that situation. I don't know how you feel about that, Greg, but I think the information.
Same. First place I always point people to is the Royal College of Obs and Gynae website, and I agree. I've looked at it relatively recently. Actually, it's brilliant. Really good, really clear, very public facing, lots of very friendly information. In my experience, the midwifery teams up and down the country are pretty clued up in this and pretty savvy, and always have a conversation with the midwife. Again, there aren't any circumstances where it's better to not be vaccinated than to be vaccinated if thinking about having a baby in the immediate future or sometime in the long-term future, and or pregnant now. In all circumstances, it's better to be vaccinated. And I know full well, I was talking to one of our consultant midwives the other week, there are people in intensive care in Sheffield last week who were pregnant, and one of them had to have a very, very, very early induced birth. Both mum and baby are fine, I think, but it's not a thing that we want, and we'd rather prefer that people were vaccinated and reduce the risk to mum and baby.
Thank you. That was very, very clear answers. Moving on to syncope, POTS, and reflex anoxic seizures. Am I likely to suffer more with the side effects of the vaccine, as I already struggle with POTS and reflex syncope? And my son was diagnosed with RAS when he was 10 years old. Should he also have the vaccine?
The answer to this, yet again, is yes. What we do know, Trudie, is that we see, and at the moment we're calling it a POTS-like illness after COVID, where you seem to have quite high levels of autonomic switch on, so you become very sensitive. So we're seeing patients who previously had no syncope symptoms, who have now got symptoms which resemble POTS, but we're so far being reassured that this isn't POTS, because POTS, as many of our patients and subscribers to the charity know, is a lifelong illness. You don't get better, we treat you with your POTS. Where the COVID-induced POTS-like syndrome seems to resolve itself, hopefully within about 9 months. And I've definitely seen people who have been affected like that. I've got one of my patients who was just vagal previously, who unfortunately has now progressed to a much more POTS-like illness. But she's getting better. But that wasn't after the vaccine, that was after COVID infection. And I would suggest that anything that the COVID infection can do, we might see a lesser extent in somebody who has the vaccine and has a very, very good immune response to the vaccine. So maybe a bit, but nothing compared to having POTS. One thing that was interesting for our vaccination teams is that people who knew they were vagal and knew that they could suffer with syncope were coming forward for their vaccine, but not telling our vaccinators. And so they would go into the waiting room, because we were working in a very, very quick, you come in, we jab you, then you have your 15 minutes. And they would faint in the waiting room. So our people looking after the post-vaccination room got very quick with pillows to the floor, legs in the air, the normal things that we have to do for our vaccinators, for our syncope patients. So I would make an appeal to people who know that they can have a tendency to low blood pressure, know that they can syncopate, that if they tell the vaccinator that that's something that could happen, that can be taken into account. And it's not the vaccine per se, it's anybody jabbing you with a sharp needle that could stimulate a vagal episode and cause you to collapse. So just a slight plea from the vaccination teams there.
Thank you. Greg, what is the difference between the immunity you get from COVID-19 and the immunity provided by the vaccine?
So not much, in short. The problem is that the immunity from the disease comes with some significant side effects, the ones that we've been seeing splashed all over the press for the past 2 years, people dying, etc. Those can be quite significant. But the actual basics of the biology of the immune response is reasonably similar across disease and or vaccine. Those that have called for disease-based herd immunity, i.e., get infected and then you will have immunity. Well, basically, you're calling for a scenario where large numbers of deaths are going to happen in people who aren't immune, and I don't think that's a terribly responsible thing to do. But the basic biology is pretty similar. So the sort of the antibody and the T cell response is reasonably similar. I think, and this may be a question for an immunologist, I think that vaccine-induced immunity gives a stronger and more durable immune response. And where I normally point people in those kinds of questions is the British Immunology Society website, who have produced some amazing patient-facing information leaflets. I may go and do my homework and just double check, I'm sure there. But the basic biology is broadly the same, possibly with a tip towards a stronger immune response from vaccine-induced immunity. And with vaccine-induced immunity, you don't get all of the side effects that come with COVID, which we really, really want to avoid.
Thank you. This is a question from a daughter about her 90-year-old mother. Can the side effects of the vaccine, especially if there is a fourth booster, be more severe in a 90-year-old? My mother was very miserable after the last jab. She's not in a care home.
Well, I'm sorry that she was miserable, and I hope the side effects recovered reasonably quickly. On the fourth dose question, I think there probably will be a fourth dose. That's an educated guess. I don't know that, but I do think there will be, and it will be just part of the routine immunisation schedule. On the are the side effects more severe in the very elderly? Probably not. There are side effects, but I think the side effects aren't terribly age specific. The ability to cope may be less for somebody who's very, very old. So, but the actual intensity of the side effects might be the same. That's my sense on it.
This bug is very, very nasty to the elderly.
Sure.
So this is a bug that makes my children angry because they have to isolate because they don't feel ill. People of my age feel pretty lousy and kills older people. And so, again, we get to that risk and benefit of the jab. What is true to say is, as you're older, you generally develop less immune response. So, if you are offered a fourth vaccine, that is because we are worried about how the vaccine-induced immunity is waning away, and that is almost certainly going to be more noticeable in somebody in their 80s than it is at somebody who's 18. And so that will be the requirement for the further vaccination. The vaccination program of the young is there to try and stop active, really nasty open infection in the older population being spread around by those young folk who don't get particularly ill, so are out spreading it. If it weren't for my daughter's PCRs and lateral flows, none of my daughters showed any symptoms or signs which would suggest that they had COVID. And it was only those routine lateral flows that they were doing for school that highlighted that there was a problem.
Interestingly, my 96-year-old father had a sore arm after each of his vaccines, whereas my younger daughters both had quite severe side effects for 24 hours, but they were fine. Better that. So yeah, I think, it just demonstrates how it's not necessarily age related, and it's still far better to go ahead and have the vaccine than the risk of getting COVID itself. The next question, I have very low blood pressure and faint quite frequently. Now, Matt, you touched on the fainting. Will the vaccine affect me in any way? I've been holding off through fear.
What you need to do, and you'll know this well, particularly if you are somebody who visits the Arrhythmia Alliance and STAR's websites. What you need to do, keep your fluids up, keep your salt up, make sure on the day that you go for your vaccine that you've eaten that morning, that you've drank well, that you're taking the precautions, and it won't have any long-term effect on your syncope. But when somebody jabs you with a sharp needle, that might have consequence. So try and make sure you're really robust before you go. Have a small drink of water which you've allowed to come up to room temperature, so that if you feel that faint after you've had the jab, you can guzzle that down, because of course we now know that rapid drinking of warm water can actually boost the blood pressure and stop you feeling so lousy. So just take precautions, make sure the vaccinator knows that you're somebody who tends to have low blood pressure and could faint. But the long-term consequence from the vaccine, not at all, no. But try not to hit the floor when you have it.
Thank you. Greg, does having side effects from the vaccine mean it's working? I didn't have any, says this person, so am I still protected? You sort of answered it in the last question, but just, to reiterate.
I mean, you could say that having side effects is an indicator of some response. It's hard to know whether or not that means the vaccine is working or not. The only way to definitively know at individual level is an antibody test. Actually, they're not routinely recommended because we all have trouble interpreting what the antibody test actually means. The honest truth is at individual level, there's no definitive way to know whether or not the side effects mean working or not working, and or the am I protected or not protected. Looking at all of the data together, at sort of population cohort level, the effectiveness of the vaccine has played out in a way way more positively than I dared hope for a year and a bit ago. A year and a bit ago, I thought, well, these are looking quite good in terms of protection against severe disease and death. But they've played out hugely more positive than I dared hope for. And the way to test that is to look at the infection rate and the hospitalization rate and the death rate in those who are vaccinated versus those who aren't vaccinated. And the difference is, still, even with Omicron, 85% reduction in risk of death. They are odds I would take, actually. And plenty of people have taken them. But the honest answer is, at individual level, there's no definitive way of knowing. But the scientific data as a whole is crystal clear. These are hugely effective and hugely impactful vaccinations. The old adage is that vaccination saves lives. Who knew? And thus it has played out with this one too.
Thank you. Is the vaccine safe to have if you've recently had a TIA, a mini stroke, or a full-blown stroke? And if so, how soon afterwards should they get their vaccine?
Greg has already alluded to the fact that one of the vaccines has shown that there's a risk of clot. And it's really important to emphasize that A, that's really, really rare, and B, it's a completely different way of forming clot to the way that we see in atheroma. That's when you're clotting an artery, where you usually end up on aspirin afterwards, or the kind of clot that we form in atrial fibrillation that forms within the heart itself before spinning off and flying to our head to cause a stroke. So those forms of clot can be affected by aspirin and can be affected by anticoagulants. The form of clot that you might get from AstraZeneca, the VIT syndrome, that is not caused by the same process, and so is unrelated to your stroke and is unrelated to your TIA. That is a completely different process. But we know that people who've had strokes and TIAs are more likely to have nasty consequence of COVID. So I would be keen to have somebody who's chosen not to be vaccinated, who, if they suffered a stroke or a TIA, I'd be really keen to get them vaccinated and get them double vaccinated quite quickly, because of the risk that their body has demonstrated that COVID will have a nasty effect, because I don't believe the vaccine will have a nasty effect.
Thank you. A lot of people are saying, I had my vaccines, I had 2, I had 3, and I still got COVID. What was the point of the vaccine? It obviously didn't work. Now, I've just recovered from COVID, having had all 3 vaccines, and I'm just grateful that I'd had all 3, because I was pretty rough, and I just kept thinking, my goodness, how bad would it have been if I'd not had the vaccines? But a lot of people think otherwise. What are your comments? I know what your comments will be, but let's say it to the camera.
No vaccine's 100% effective. No medicine's 100% effective. We wish they were, but they're not. That's just the reality of it. Hugely effective in terms of reducing severe illness, hugely effective in terms of reducing death, and actually hugely effective in terms of reducing symptomatic illness and asymptomatic transmission. Again, from memory, the chance of in a vaccinated person is about 50% less likely to acquire the infection than someone who isn't vaccinated. So you're less likely to get it, but not 100% less likely. You're about 50% less likely. And if you do get it, you're less likely to have a severe illness or a severe reaction to the virus compared to if you weren't vaccinated. Again, not 100%, but significantly less. There will be people who have had the vaccine and have been quite poorly. But as you said, imagine what it might have been like if you hadn't been vaccinated. And that's the thing that we're all trying to avoid here.
And we had a comment from our local ICU consultant when, unfortunately, Bradford hospitals was having to stop operations again because there was no ICU space, that everybody on intensive care was unvaccinated. So that didn't mean that everybody in the hospital who had COVID was unvaccinated, but that really nasty, severe illness was showing itself in the unvaccinated population. To a certain extent, Trudie, you probably are now more protected than I am, and I've had my 3 jabs, but if I've had COVID, it's been completely asymptomatic at this stage, and so you're now more protected because you've had your 4th dose.
I read that recently, that people that have had 3 vaccines and COVID have super immunity, so I'm hoping that's true.
Yeah.
Well, we've always thought you're super, Trudie, today.
Oh, Matt, you say all the right things.
How I'd expect this to play out in the long run is that Omicron will probably catch us all at some point, if it's not caught us yet. We'll just develop a sort of vaccine-induced level of immunity across the population that will be then supplemented by disease-based, further disease-based kind of immune assault and then response. And that just over a period, that develops population immunity that will probably protect us, not certainly, but very, very likely protect us against the huge waves of very, very severe illness that we saw way back in kind of March 2020 and then into autumn 2020, winter 2021. So I genuinely think the worst is over, unless there's a very significant shift in the nature of the virus. And Omicron was a significant shift, and it did worry us quite a lot about the level of immune escape, but it hasn't played out. It hasn't played out according to our fears, which is obviously good news.
I suppose it's a little bit, years ago, flu was an absolute killer, whereas now with the flu vaccine, and it can still be fatal, but there's far less risk, and that's.
Flu is a killer. Still, in a bad year, flu will kill 30,000 people, and actually, no one seems to care. It's just something that we accept and we tolerate. At the moment, right now, we're in the depths of the flu season right now, and I don't know if it's the same in Bradford, Matt, but in Sheffield, it's what's flu? We're not seeing it because people are wearing masks, people are washing hands, and the things that do make a difference. And we've got pretty high levels of vaccine coverage at the moment, so we're not seeing it. But flu may make a resurgence, and it still does kill people. It's still a pretty serious illness, particularly in the very old. So hence, it's important that we do not forget vaccinating people against flu too.
I think it's also, when we talk about flu, Greg, it's also important to think that we go for our flu jab every year, and we don't get the same flu jab every year. We get a different flu jab every year. And that vaccine has been developed in a very small space of time to make sure that it's the appropriate version of flu for what might be in the next pandemic. And it's experts like in public health and in immunology who determine what that's going to be. And we have to trust them for COVID. We've been trusting them for flu for over a decade.
Is this a case of too much information on COVID on our televisions every single day?
Oh yeah. Who wants to see more news coverage of COVID? No, who's sick of COVID? Yeah, we're all sick of COVID. Just on the flu. So the flu vaccines that we use very, very effectively, and most people who have them don't blink an eye, are significantly less effective than the COVID vaccines that we've got, actually, in terms of the vaccine effectiveness. So that, as we have learned about vaccine science through the course of the COVID pandemic, we may well apply some of that science to flu vaccines and get even more effective flu vaccines in the future.
Thank you. Now, I'm very much aware of how valuable your time is. So there's just a couple more questions directly related to arrhythmias, AF, etc. So I will combine them and then wait for your answers. So can the vaccine cause heart failure in the elderly with a history of cardiovascular conditions? Can the vaccine trigger an arrhythmia such as AF? Many people have contacted us who were diagnosed with AF, said as soon as they had their vaccine, they went into AF, which may have lasted hours or even weeks. And can the vaccine increase body inflammation? So can the vaccine cause heart failure? Can it trigger an arrhythmia such as AF? Can it cause body inflammation?
So if I can take the first two easily, if you do not have heart failure, and remember in heart failure, you may have heart failure because your heart's going too fast, or you may have heart failure because the pump itself is failing. If you are previously undiagnosed, no, it's not going to cause it. It's not going to cause your heart to fail in older people. There's some questions about what might happen in very young people, but not in older people. So we can definitely reassure about that. If you have heart failure and your heart failure is finely balanced, as we've said, you can feel pretty lousy after the jab, and that might decompensate your heart failure slightly, and you need to talk to the doctor, because that might mean you need your medication briefly changing around a little bit. But that's only in people who have got quite severe heart failure and are carefully balanced. Those with paroxysmal atrial fibrillation, I'm afraid the answer seems to be a little bit clearer. That there seems to be, within people with PAF, if you get an inflammatory illness, and many people with PAF will know this, when they get coughs, colds, urine infections, it provokes their episodes of atrial fibrillation, and we are provoking an inflammatory response with our vaccine. So they may find that it causes a paroxysm, but you should, of course, be appropriately stroke risk assessed, and therefore you're on an anticoagulant if you need it. And as most people with paroxysmal atrial fibrillation know, the number of paroxysms doesn't increase your stroke risk. It may be unpleasant to you, and it may give you symptoms for a short while, and you may need to whip that flecainide out of your pocket to terminate that episode. But it doesn't increase your mortality, and it doesn't increase your stroke risk. So the benefit from the vaccine still sits in the vaccine bag, even though you may have a paroxysm of atrial fibrillation. Does it cause general body inflammation? I would argue that's why you feel hot and sweaty after you've had your vaccine, is because, yes, it's done that the same way COVID will do that, the same way a cold will do with that, the same way that flu would do that. It does cause an inflammation.
On the inflammation point, yes, I would have said exactly the same. But as does COVID. COVID comes with all sorts of horrible, nasty side effects, as we've seen. So it's always a risk-benefit type of balance, and the ratio is in favour of being vaccinated by many orders of magnitude. The inflammation and the hot and sweaty from having been vaccinated usually settles with paracetamol and a wee bit of rest in everybody.
And the last question, which probably is the most common of all, is I've been experiencing heart palpitations since receiving the vaccine. Is this normal?
Lots of people do. So in people who've had COVID, we have lots of people reporting palpitations. And in people who've had the vaccine, we've had people comment that their palpitations that have previously settled, particularly when they've had just frequent ventricular ectopy, that seems to have resurged after the vaccine, as well as COVID itself. So the palpitations that we see post-COVID, yes, we do see them post-vaccine. It's interesting, when we do cardiac monitoring, frequently we don't see any change to the cardiac rhythm. So it seems to be more of an awareness of normal cardiac activity causing those palpitations. But one of the patients I was chatting to, we realised that actually before he had the vaccination, he was choosing to limit his social interaction. He was choosing to stay at home more, and so he wasn't doing his normal activity. Once he'd been vaccinated and felt a bit more protected, he was getting out a lot more and doing his exercise again. And what we know in anybody who is active and then goes through a time where they're less active and becomes active again, they tend to get a bit of ectopy, and they tend to get some palpitations. So lost within the stuff about the vaccine is those people who become slightly cardiac deconditioned due to the lockdown, and they've noticed their palpitations resurge, not due to the vaccine, not due to COVID, but just due to the fact they're free from their homes and they're out jogging, they're out walking, they're out enjoying life again, because they feel the reassurance of being protected by the vaccine. So yes, is the answer. Are they dangerous? No. Will some people who have a tendency to AF that they previously didn't know was there discover their AF after the vaccine? I refer to my previous answer, which is that we know that AF can be provoked by inflammatory responses. And so if you've never had AF, but actually you didn't realize you were prone to AF, you may find that the vaccine was the key to you realizing that you have PAF, because the tendency had been sat there for months and years before, and it was just a vaccine rather than the next cold or the next urine infection or the next general illness that you suffered that showed the AF to be there. It was just coincidence. It just happened to be the vaccine that showed you.
That makes a lot of sense. And also, I think we've all become so health aware. Any symptom, any little sneeze or cough, oh, have I got COVID? We've just become, and as you say, we've not been going out with the self-isolating, and we're suddenly much more aware of our own body, that I think some things that have been happening anyway, we now become very sensitive and concerned. Greg, any final words from you, please?
No, I don't think so. I think I've said everything I could possibly say on being vaccinated and the impact of the programme. So probably nothing more from me. Thank you. And Matt, any final words of wisdom?
I would encourage everybody to get the vaccine when they're invited. And I would also remind people that we are not out of this pandemic. We are coming out of this pandemic. And when you're in crowded social spaces, particularly if you're carrying a high personal health risk, you should still think about wearing your mask. You should still think about trying to distance yourself if possible. And of course, destination hand washing remains important. But that's important, I think, for just general good health, whether it be COVID, whether it be the common cold, or whether it be flu. It's a good idea to wash your hands when you come home. So those basics of good infection control need to stay with us, and need to stay with us in the years to come, I would suggest.
He's prompted me. One, he can do my job way better than I can. But two, the point on the hand washing, how do we know it makes a difference? Well, we saw in the early phase of the pandemic, and we are still in this phase data-wise, that gastrointestinal infections just dropped off a cliff. We're in norovirus season now. We're not seeing a great deal of it. Norovirus usually closes wards in hospitals and closes care homes when you get outbreaks. I mean, it's horrible. It's nasty. I had it once. I wouldn't wish it on anybody. We don't see it now because an awful lot more people show an awful lot more diligence with regard to washing their hands and sort of personal infection prevention and control. And I think that will stick with us for some time. We'll need to keep at it. But again, a happy spin-off of what's been an awful few years for all of us is that we'll probably see less tummy bugs of various types and flavours because we'll wash our hands a bit more.
Greg Fell, Matt Fay, thank you so much for your time. Thank you for all that you do for our patients and their carers. I think this has been excellent conversation. I know it's going to help tens of thousands of people, those that are concerned about having the vaccine, those that have had the vaccine, and just generally answering lots of the questions. So I thank you on behalf of all the patients and, of course, Arrhythmia Alliance, AF Association and STARS. Thank you.
Thank you very much.